Hi, our group members' names are Julianne Jirousek, Haley Miller, Morgan Kingseed, and Kendall Irion, and our medical surgical clinical rotation this semester is being done on the 6th Northwest Transplant Floor at the University of Cincinnati Medical Center. During completion of our clinical time at University of Cincinnati Medical Center, we have had ample opportunity to observe and discuss current clinical practices and guidelines. While being there, we have had multiple conversations with the nursing staff about what their typical days are like, in addition to following and mocking their performance. As we have observed, we have had a specific interest in learning their current practice regarding report and handoff. Currently, the nurses sit at the computers and discuss patients in the charting room. There is no set process that we have caught on to, besides location and time, 7 a.m. or 7 p.m., Each nurse uses a sheet with subtitles of important handoff information and puts the trust of the assessment of the patient in the previous nurse's hands. While doing so, some nurses will have the Epic charting system displayed in front of them, while others do not. During the handoff, nurses choose what they want to discuss and pass on to the next nurse. Due to the high amount of people and distractions, call lights, heart monitors, pagers, and other conversations, it is easily assumed that nurses may not receive the most accurate report or be giving full attention to the report being received. The assessment, diagnosis, and care of patients are often determined while receiving shift report. The report, in some experts' opinions, is of uppermost importance in regards to patient safety and care. This is where both the nurse and the patient have the designated time to be updated on the current situation and treatment, as well as what the further steps may be. In addition, it is an easy way and great opportunity to make sure the patient is knowledgeable on the nature of their hospital stay and included in their medical decisions. A satisfactory report enables the continuation of quality care by the nurse and greater comfort for the patient each day and night. With this being said, we question if patient and nurse satisfaction would be greater with the use of bedside report versus report at the computers. To begin our search for evidence, we used the University of Cincinnati Library website, including the CINAHL database. As a group, we knew the types of articles we were seeking. Therefore, we all used similar keywords and phrases to refine our search content. These consisted of bedside, report, handoff, patient satisfaction, nurse satisfaction, and patient safety. In addition, we each used two specific limitations. We made sure the year of publication was after 2011 and that the articles were written in English. From there, we each chose the article we found most appealing, reliable, and suitable to our PICO question. This process came a lot easier than expected, and we learned that many professionals have inquired about the same question. Our first article, titled Improving Client and Nurse Satisfaction Through the Utilization of Bedside Report, was a study design using literature review and therefore is non-research evidence. However, this article provided a tremendous amount of statistics and results relating directly to our PICO question. Overall, this article was of very high quality and represented a Level 5 article. Our second article was titled Making the Transition to Nursing Bedside Shift Reports. We found this to be a quasi-experimental single research study due to there being no control group or random assignment, but an intervention. With that being said, it is among Level 2 and good quality evidence. The third article we chose, titled A Quantitative Assessment of Patient and Nurse Outcomes of Bedside Nursing Report Implementation, was a quasi-experimental pre- and post-implementation design of quantitative nature. Using the Research Evidence Appraisal tool, this article was Level 2 and of high quality. The last article we used to assess our PICO question was titled Utilizing Bedside Shift Report to Improve the Effectiveness of Shift Handoff. The authors of this article conducted a quasi-experimental study on an inpatient trauma unit in a large academic hospital. After reading and appraising this article, it was among Level 2 and high quality. After reviewing multiple articles and R4 in depth, we have come to the conclusion that Bedside Shift Report has positive results and should be utilized in practice. With this being said, the current practice on 6th Northwest at UCMC is not supported by the evidence and findings we reviewed. Their form of shift report, as discussed before, is report at the computers with no assessment or routine information. This creates a chaotic environment early in the day and may lead to lower patient safety. Additionally, it is likely to lead a nurse being misinformed or ill-informed about the pertinent information regarding his or her patient. Lastly, the current type of report lowers the inclusion level of the patient in their medical decisions. The evidence we appraised had consistent results in support of bedside shift report, both by nurses and clients. The only inconsistency we found through appraisal was the time increase or decrease when implementing bedside shift report. Unlike other articles, a quantitative assessment of patient and nurse outcomes of bedside nursing report implementation found that nurses took a longer time completing bedside shift report. However, as stated before, there was no change in overtime hours among nurses, insinuating the nurses were still completing their jobs in the same amount of time. Even with this discrepancy in evidence, it is shown in statistics that report at the bedside increases patient safety, patient satisfaction, and nurse satisfaction. To conclude, we feel as if our evidence suggests a need for change in practice to bedside report.